person who can really wake up an audience is a person who's totally confused. And if you have seen the amount of confusion that has happened in my life, I think I'm an authority to speak on a subject which is enumerating, it is still developing. There is no reliable data. The data that is available is coming from very small centers where people are opening out and asking for healthcare. And most of these centers are in the West. In India, most of transgender healthcare is in the domain of private practitioners. There's nothing in the government, so to say. And hence, what we need to do today is to leave our baggage behind and listen. So let me start by saying good morning. Hi, I am Sanjay. I identify as a male. My preferred pronouns are he, him, and his. Let me walk you through this journey of learning and a shout out to the young minds who are here. Gender is a pedestal on which the foundations of I or who am I sits on gender. It's only after I affirm my gender is my orientation known or I exhibit. And but however, we start the reverse way, So we first assign sex of rearing by looking at gross anatomy, and we give cues to the child to align to a binary world. Now, at the age of about 2 to 3, when this child is sitting around and mulling that where do I fit in, this child is asking who else but the adults around for whether he is okay or not, and this incongruence between what is affirmed and what is assigned comes to the fore. He looks towards the knowledgeable people around, the family and society, the peer group, and his question is that will I be accepted? Where is my place? And if there is this fear of non-acceptance, this wall that I meet with, then I am pushed into this closet. And this closeting, mind you, may happen as early as 5 or may happen as late as post my finishing of the essential tasks that are assigned to me. Now what this closet does is, because this is a very dangerous place, here this child is closed his doors of communication with the adults who he has lost trust in. But trust is a very vital issue when we need knowledge. Like scientists here would trust a data which is from a trustful source. And in the closet, our child is interacting with other children like him or them who are across the globe, and they are giving him information that please don't come out and speak to these untrustworthy adults who really do not know your experience. And this closet, what it does is it magnifies the incongruence, leading to more and more internal conflict. And it is as a result of this, the combination of this internal conflict and non-acceptance or fear of non-acceptance, non-resolution of ideas that I have, and then what else would I do but to enter into an external conflict where I am now interacting with the world who does not understand me. And this interaction, this multi-faceted interaction causes what is known as dysphoria and magnifies it out of proportion. And it is this dysphoria which leads to high-risk behavior, which puts me at risk for new infections. So, friends and young minds, the action point for prevention is this dysphoria. Because if we prevent this, then we prevent high-risk behavior, we prevent new infections, and we also prevent the more important issues of self-harm, substance abuse, mental health issues which this marginalized community faces day in, night out. So, where is this transgender person that we are talking about? A large majority is closeted. They have probably entered into deeper closets within the closets, and they are invisible. They may be living with families, but they are invisible to people who are designing programs to prevent new infection. And mind you, they are getting their information for other kids like them, who are telling them what they did to circumvent this. And this is a very high risk situation. But don't get depressed, A very small percentage do find the courage to come out. And surprise, surprise, we have some adults who do say, okay, apna bacha hai, let us support, and they continue living with supporting families. They become visible for healthcare that is given by the government, and the risk does get mitigated. A lot of children who have come out, however, don't have this experience. They find that home, which should be a safe environment, is really abusive. They are being exposed to conversion therapies, which are no longer ethical, and they are thrown out of families. Or the situation becomes so bad that they run away. They don't have any support, they are on their own. And they are what we define as visibly invisible. They are visible because they are out. They look different from you and me. I am expressing as male, female. There is somebody who looks like a male and he tells me that he is female, or they have a different expression from mine. And this is a very high risk situation. Because though he is visible, he is invisible again to the agencies which are designing projects for them. And they are also not identifiable with any group. We also have a group of transgender persons who, having learned from the experience at home, do not come out when they are on their own. Now this is even worse because they are totally invisible. And some of them who do later say that for safety or something we need to associate with some group, and they become a part of a community, and the LGBTQI plus community, different clans and sects, so they become visible, but there is a small price. They have to follow those traditions and practices which come in, and this is the one place or space where they are at least safe and secure. And this small, less than 1/5, but even in this 1/5, the PG component is again 1/5 of that 1/5, and towards which we have designed our target interventions. So having understood this, let us look at what are the priorities for whom we are going to design a program. Because if you do not know the priorities of your client, like I don't know what my client wants, I can't sell him the best of what I have. So my transgender person, his priority is gender affirmation. That's his first priority. Because this is what dysphoria is all about. And then he wants safety, security, financial help, legal help, social support, equity, and mind you, HIV prevention is way down his list. If he's going to survive the 4th decade, yes, probably he will need to understand what HIV, which is got such a big window, and maybe I will have a disease which requires treatment if people don't kill me before that, or I don't kill myself. Yes, NACO's priorities will and should be HIV prevention. So what we need to do is open our minds and do a public health approach. Science, when it is sitting on a shaky ground of unsure data, needs to open its mind and be ready to accept an integration of society, the medical people, the delivery, and the client. It has to be participative. And this integrated model, which we have proposed, and we have pitched it to UNH, we have pitched it to a university in Delhi, and we are planning to pitch it to the government through you, and we hope and we want that all of you should come and be a part of this experiment to see if this model really works. And it has got four pillars. Four pillars: knowledge, healthcare, empowerment, and mainstreaming. Knowledge has got three studs. The first one is a center of excellence. Because if you have a place from where you can have that issue of trust, that data is trustworthy, the teacher is trustworthy, then I can educate my transgender outreach worker, my peer educator, on all other issues, and his priority list can be ticked off. I also need to educate the medical people, the nursing staff, the paramedicals, the legal, the social worker, each and every person who comes in contact with the transgender person, so that I can give this experience.
Yeah, can you just finish it as fast as possible?
Yes, I will do that, sir. So, any research, anything cannot happen till there is a subject which we study. And hence, it's very important that we introduce this as a curriculum. And IAC activities are needed, again, as a part of the knowledge base. And this activity needs to be holistic. Healthcare needs to be delivered through gender clinics. Clinics where, apart from preventive care, we are also talking on issues which are priority for the transgender. Counseling services, hormone therapy, gender formation processes, primary health care. We need a department of transgender medicine and surgery in the hospital, which will liaise with various subspecialties and ensure that secondary and tertiary care is given. For all this to reach the person, we need empowerment. And empowerment means that we need gender ethics committee, we need legal cells, we need health insurance. These procedures that we are talking about are expensive. The current price that a transgender would imagine if he was to go through the private route is 20 lakhs plus. And 20 lakhs plus is a S-class Mercedes car, sir. We need the government to support. Provisioning of a single window for getting their documents to say what they are saying is very important, because this is another reason which increases dysphoria and hence is a preventive step. It's just not a social issue. It is only then can we talk about mainstreaming, and mainstreaming means that we do handholding, we need reservation, and in fact we are doing NACO that get other government departments to sit with you to have a representative from Education Department, Ministry of Social Justice, so that we can do this checklist complete. And so, with your permission, I'll just take precisely 40 seconds more, because this ode to the program director sums up what I've said, and I'll read it out to you. You, the cis, you broke the trust. Mend it first. Yes, you must. Don't miss the forest for the tree. It's very important to understand me. For what and how I do to you is an outcome of what to me you do. Hence, to make it safe for both you and me, we need to look beyond HIV. The truth, it hurts, yes, it's bitter. But I am trans, not just a transmitter. For me to toe the line, the best interest has to be mine. But destined to wither is a flower. plucked and thrown. However, not so if nurtured as your own. Yes, nurtured as your own. Signing off, I trans. There is science in what I say, so I have put that in the footnote. And whatever I have Richard has allowed me to speak today is based in science. It is based in that slightly shaky ground, and I would implore the young minds to go to WPATH site, read the standards of care, read the protocols that are put out by various subspecialties where transgender care is there. And please have a look at that video that I was talking about, because that is stark reality. That is what our culture is. And if we have to address this topic, then it has to be culture based. Thank you, sir, and thank you for allowing me to exceed my time. Do I take the chair and the next question? Thank you. That's my objective.